Hello, I'm Dr. Jay Noreen. Welcome to Health Talk. In the course of living, we all sustain wounds, cuts, some serious, most not so. But there are people for whom even the smallest wound can lead to serious complications. And so here to talk about this today are nurse June Smith and physician assistant Shelley Smith, both of Appalachian Regional Healthcare System. They work at the Wound Care Center, a very specialized center that deals with the complications of wounds. So thank you for being here. We really appreciate it. It would be great if you could tell us a little bit about how you got into this specialized area of patient care and how your career's moved in this direction. We'd be delighted to hear a bit about that.
This is sort of a late-in-life career shift for me. So I was originally introduced to wound care as a physical therapist assistant many years ago. Yeah. And I had experience doing wound care then and learned a lot, really enjoyed it. In fact, we could sort of kind of behind the scenes flipped a coin to see who could get the next wound care patient because we didn't have that many of them where I worked initially. So I wasn't the only one there that really enjoyed it. So that love carried over, and when I finished PA school and came back to the Boone area, it was an opportunity that kind of presented itself, and I was excited to be able to pick up at that with that wound care that I used to do and enjoyed so much.
Oh, interesting.
So it was kind of a neat little segue there.
Yeah.
Yeah.
And Nurse June Smith, how did you get into this special area of patient care?
Well, I did home health. Most of my nursing career has been home health. And so I had a mentor here at Watauga Medical Center, and I would always call her and say, Tracy, help me heal this wound. What's going on with this wound? And so they would always give me the wound patients in home health. And so that's when Tracy decided to retire and said, would you like my job? And I said, yes, I do. So I went back to school and became a wound ostomy continence nurse certification. So was able to do that. And so I've always enjoyed wound care in home health. That's how it led me to where I am today.
So you actually have a special certification in wound care. And how do you get to that? What do you need to do to get that certification?
It's the Wound Ostomy Continence Nurse Society is a national board certification, and it comes from one of the things that happens is you have to have your bachelor's degree in nursing, and once you have your bachelor's, then you can go on and get your certification and take a course. So you can do a long distance learning or you can do it on campus. I went down to Emory University and was able to do the course. So it's a semester course in 6 weeks. Oh. And then you do 120 hours of preceptorship under another WOC nurse.
So it's quite specialized, actually. You know, I would guess that a lot of the viewing audience would not know about the Wound Care Center, that there is such a thing. Can you describe a bit about how it operates and how patients get to you?
Well, I'm a physician assistant, and we seek referrals from area physicians that send patients to us that have identified needs. Sometimes our local surgeons or a primary care provider may have a patient with a wound of some type that just won't seem to get better, and they end up coming to us. And once they have the referral, we get the appointments made and get them in and see them and do our best to not only evaluate the wound but also any other underlying factors that may impede wound healing. And that may be anywhere from their vascular status, you know, how good or poor the blood flow is in the lower extremities if that's where the wound is, or nutrition if that may be an issue. And you know, diabetes is a big part of wound healing, and we have nutrition consult the folks at home and help them with dietary needs if there's an issue there to get blood sugars better managed, which then helps wound healing. And we also have post-surgical wounds that get referred to us as well that for some reason the wound itself did not heal or it had to be reopened because of an infection or something like that. So we get a variety of wounds as well as the variety of causes as well.
Just recently, we had some guests to talk about diabetes care, and you know, I think the general public doesn't realize how common diabetes really is, and as well the complications, some of which are in fact poor healing and peripheral vascular disease, poor circulation in the extremities and how that affects such things as how rapidly or how fully wounds heal.
Definitely.
Other things about, how about from the nursing perspective, how does the wound care center operate?
So one of the things that we see is we're a department, so we work through Watauga Medical Center. We also work at Cannon Memorial Hospital. We go in and get consulted for patients that might have wounds. They might be in there for congestive heart failure, and they have found, when the nurse did their skin assessment in the hospital, they found that they had a wound, an open wound, and that's how we get consulted. So we'll go in and see the patient there in the hospital and say, well, we need to get them to vascular surgery, or we need to see them, have the surgeon see them, or we need to refer them to home health. It could be the wound care center also as well. So home health is for those patients that are homebound and can't get out and go. And so if they're able to get out and go, we would refer them to the wound care center for their care as well. So nursing will, in the hospital, we refer them over to the wound care center. And then at the wound care center, we're a part of that team, helping to take care of the wound, decide what needs to be done to that wound care, help to facilitate wherever we need to go.
Get discharged.
Yeah, at discharge or consults or to other facilities, that kind of thing.
Now, are you located principally in an inpatient setting, or do you do outpatient access as well? Do people see you as outpatients, or mostly do you see people as inpatients?
That would be, I would say both.
Both.
So our facility, the Wound Care Center, our outpatient department, has moved off campus from the hospital. We've been there now 3 years on Doctor's Drive.
Okay. And
we then go and see the patients in the hospital based on the consults that are recommended from the hospital. So I would say we see more patients on the outpatient setting than we do inpatient. But we are covering several facilities as well. So
So you said Cannon, Watauga, and others as well?
Blowing Rock is a part of our long-term care facility. We also go and consult there.
Okay.
We now have a wound care nurse there, so we're not there as often.
Okay.
There.
You have somebody on site there. Yeah. And you mentioned home health services for wound care. Do you do that, or do you connect with home health services and provide advice and consult to them? Which way does that work?
We have 2 home health agencies in the county that we refer to, and they will provide the wound care that is needed, maybe a special dressing called a negative pressure wound therapy, a wound vac, so to speak. And then we would have them periodically come in, maybe every other week or every week, to see that patient and see how the wound is progressing. So they go in and do the wound care in the home, and then we will evaluate and see those patients on a regular basis.
So you're kind of, in many ways, a consultant to the home health care people, but then you do the more consultative evaluation as need be.
And on those follow-up, if there's any change in the course of the wound healing, or if we need to change the plan of care, that's when those treatments are adjusted to meet the changing needs of the patient.
Now, what's the volume of patients you see? What's a typical day or week of the number of patients you'll see?
She's the numbers person. So.
You're the numbers person, okay.
Well, it usually runs between 10 and 14 a day.
Okay.
And we are usually seeing patients 4 to 5 days a week. It just depends. Usually our summertime is a little busier. We do have folks from off the mountain that come up, and this is their summer home or their retirement. And so we might be a little busier, but you never know, because sometimes the evening, like last December, we were just really busy. And it's not really a typical time for us. So it just depends on the wounds that we see. So.
Yeah. Can you talk a little bit about what kind of wounds you see? I would guess the average person viewing would not really know exactly what is that. What does that mean? A complicated wound. What does that mean? What kind of things do you see?
A lot of times, if you've had a wound that's been around for more than 3 or 4 weeks, we start recategorizing that as a chronic wound, meaning something is preventing it from healing, whether it's high blood pressure or high blood sugars or pressure from ill-fitting shoes or some kind of foot deformity that's creating a pressure area, things like that. Or if it's an injury and for some reason there's, compromised blood flow. So there's different things that will cause the wound. And in terms of treating those things, we have a variety of options that we can recommend based on the age and that kind of thing. But if you've got a wound that just hasn't gotten better, or if you've got swelling in your legs and you've got a wound that is related to that swelling, say you developed blisters that then became a wound, then it's important to talk to your regular doctor so that they can do their assessment and decide if you would be a good fit for the wound care center to do an evaluation and see what we can do to help. So there's a lot of folks out there that don't know we're there, and they struggle for a long time, and they say when they finally get to us, I wish I had known about you 6 months ago.
Sure.
So we have some people for quite a long time because of the nature of their wounds, or they all develop other wounds for different reasons while we have them. So most people are not there that long, but others we've had a few, low percentage, but we have a few that are kind of our regulars, and we get to know them, and they bring us corny jokes, and we have fun with them. So the Wound Care Center is not an evil place, and so you don't have to dread coming. So we try to have fun as well, because we have the luxury of spending time with folks and getting to know them a little bit. So it's not just a similar visit like you would see when you have to go to the ER for an emergent condition. We have that luxury of being able to get to know you a little bit and more about your family a little bit. I mean, not a lot of extra time is spent, but we do try to make that environment as comfortable as possible. And I think that that's a big part of wound healing as well.
It's more continuing care, a continuity of care, as opposed to an acute episode.
Exactly.
It's more ongoing
And we try to involve family members if we can in different aspects of the care as well. So we try to make it not just the patient's responsibility, but a community effort.
Yeah. What kind of advice do you give, I expect you do this a lot, to patients who you see about what they should be doing at home? And it probably varies with the type of wound, but can you give some idea of what kind of training you give to the patients to do some of their own self-care?
One of the things that we do I keep referring to diabetic feet because that's a lot of what we see. We will recommend that folks check their feet on a daily basis. When they take their shoes off at the end of the day, do a quick check to make sure there are no red spots or any pressure areas that have formed during the day. And for those that don't have ability to look at the bottom of their foot, what we do is we give them a mirror that they can lay in the floor and assess their feet that way. Or they have a family member that will check their feet for them and look for different things. And so we try to catch those early before they develop into an actual open wound if possible. And once they do, of course, we kind of shift gears into more of the wound care instead of the preventative role. But our goal is still to make sure that the person doesn't progressively make that wound worse, so that we can hopefully not have any kind of complicating factors such as amputation or something like that. Sure. So we try to prevent those things as much as we can.
Can you just go ahead?
Yeah, we talked to them about their blood sugars as well, is that how important that is to keep your blood sugars down, because that really helps. The studies show that blood sugars on a regular basis, less than 180, preferably 150, which is kind of difficult for some people. That makes your wound heal a whole lot quicker. When we talk with patients that have venous stasis disease, meaning that the blood goes down artery-wise and the blood comes back up venous-wise, the reason why we do compression, we are big advocates of wearing our compression hose to show them how important it is, because as a nursing staff and we're on our feet all day long, how important it is to get that blood flow back up the legs, and helps with wound healing, because if you have a really swollen leg and the veins aren't working as well as they've gotten older, then the reason is we compress and we are able to get rid of that fluid and get that wound to heal faster. Compression is a very hard thing for an 80-year-old to put on a compression stocking, so we help them with that. Understand the reasoning why we do those types of things. So a lot of education. There's a lot of education, because some of our seniors like to dry out the wounds. I remember when I've been a nurse for quite a while, so we used to dry out all the wounds, everything. But the best way for wound healing, they found through the studies, is that nice moist wound environment. So the cells are much happier when we have a nice moist environment. And a lot of people want to make it a scab or make it dry, and you don't heal as fast with that. So there's a lot of education on this for those patients about how do we get this wound to heal better.
Now, there are, of course, a lot of people who have wounds who have not seen you, so you haven't given them that advice yet. What kind of advice, what are some basic principles for people who have chronic wounds or non-healing wounds or whatever? You just gave one. Moist is better than dry, contrary to past beliefs. What other kind of advice would you give for those people out there who may have this problem but haven't come to see you yet?
Well, just to piggyback on what I said earlier, check your feet daily, just to make sure that you're catching things early. And ask your doctor to look at something if you have a problem that you discover. And let's see, I'm trying to think what else.
Nutrition, wound healing.
Okay.
If you are a type of person that is not really doing a whole lot of nutrition, proteins, things like that, where some of our patients might decide to cut their Meals on Wheels in half. And so they're not getting that protein intake to help with wound healing, making sure that they're drinking fluids well, that sometimes they won't drink as much water because then they have difficulty getting up and walking to the bathroom and being able to go to the bathroom and do those types of things. So nutrition is a big part of wound healing as well. And if you have swelling in your legs, prop them up. Put them on a ottoman, or sit in the recliner or something like that to keep your legs elevated. That helps also get the fluid back up, and it doesn't pool down in the feet, so to speak.
Now, what kinds of treatment specific do you use for a non-healing wound? What kind of medications? You've already mentioned some of the things people can do themselves, elevating if they have swelling in their legs or whatever. But what kind of specific treatments do you use for a non-healing wound? There
are a lot of different approaches to treating wounds, and in terms of the fancy wound care products, there are thousands, literally over 3,000 choices, and fortunately we don't have to remember all of those.
Yes.
But we use ones that are based on scientific evidence that we have. We also look at cost, and one of the things that folks get recommended quite frequently before they come to us, they'll be prescribed a prescription for like an antibiotic ointment that their primary care provider or some other physician may have given to them. And if that didn't work, or for different reasons why it didn't work, then that's one thing that we still use in the clinic. One thing that we find that folks shouldn't do at home is using peroxide for a prolonged period of time to clean a wound.
Okay.
It's great when you first have an injury, but after about 2 or 3 days, you don't want to continue to use it because it will actually delay healing. So with that in mind, that's another piece of the education she was referring to, is that we try to prevent practices that may delay healing as well. Because we're all used to trying to make do ourselves and heal with what we've got, and there have been some creative salves in the past that have really helped things, and I'm not against those things, but we want to make sure they're safe. And so we try to teach about those things. But in terms of specifics, probably we use things that maintain moisture in the wound bed to create that ideal environment. Some wounds drain a lot, so we try to make sure they're not too wet, so that they don't delay healing by being too wet. So there is a balance between too dry and too wet. So there are products that will balance that better than others. She mentioned earlier the wound vac, which is a negative pressure wound therapy. It is a system where there's a little machine that creates a negative pressure suction on the wound, which increases blood flow to the area, which then impart better nutrients, so that then there's better chance of healing. It also collects drainage and takes it away from the wound, so that that drainage is not sitting there impeding wound healing or increasing risk of infection. So we use that modality quite a lot. And again, compression to help manage swelling in the lower extremity, because that increases blood circulation when we minimize that swelling. So there's a lot of, without getting into specific individual products, there's a lot of options that we can try, and some are very user friendly.
This VAC process you use. How does that work? How long is it applied to the wound? For how long a time? And can it be done at home, or is it just done in the wound care center?
It is done in the wound care center.
Okay.
We change it 3 times a week, and it's worn 24/7.
Okay.
So it's a continuous therapy, and
So it's worn.
It's a little pouch with a
Okay.
little machine that's attached to you with a little belt pack thing, and then you have a tube that goes to wherever the wound is.
Okay.
So it can be fairly discreet, so it's not like you're carrying around some big black thing that people are like, what is that?
So you use this all day long, basically?
Yes. People sleep in it at night, and they plug it in and charge the battery in it, so during the day they're free to go about doing their daily activities. They don't
And
feel
what's
like
it called again?
It's a wound vac. It's
Wound vac. And how long would people typically use the wound vac? How long a time period over time would they use it for? Like a week, or depends on the wound, I suppose?
It does depend on the wound. I mean, I guess on average, I would say 3 months or less.
Okay.
Obviously, some folks, if they have a really large wound or other circumstances, it may be longer, and certainly much less at times. But on average, if it's something that qualifies for a wound vac, it would be usually at least a few weeks.
Yeah, okay,
It
okay.
has to be a fairly large wound.
Yes, I would guess.
In order for this, it's an expensive therapy, but
Sure.
it's a very, decreases the wound healing by 50%. So you heal that wound a whole lot faster than something that would take 6 months. We could probably finish in 3 months.
Now, for the patient who goes home after a surgical procedure, or who has had an injury and has a wound and has gotten initial treatment, what should they look for to get worried and come back to their physician and to the wound care center potentially? What are the signs that they ought to be looking for to be worried?
Well, at the wound site itself, you look for increased redness or swelling, certainly increased pain, or a change in the amount or type of wound drainage you may be having. If it was sort of a clear a little bit one day and it's now starting to change colors, or it's more of it, those are signs that something may not be exactly right. So like if it's a surgical wound, the first thing you'd want to do is talk to your surgeon. But if it's something that you've seen the surgeon for and it's something that needs to be managed on a more long-term basis, that's certainly when we would get that referral from the wound care perspective.
And what about other services in the community? You mentioned you had started out actually originally in PT and got interested because of that experience. What are the other collaborative providers that you work with in your overall comprehensive wound care services?
So we might find that that patient has what they call lymphedema, that the swelling is not all related to venous stasis, and we would refer them to occupational therapy, which will help with lymphedema, moving the fluid through the lymph system. So it's also some wraps. We also put total contact cast on patients that it would be for offloading if we wanted to had a wound on the bottom of their foot and we wanted to offload them and put them in a casting system. It changes their mobility. So we may refer them for physical therapy. It may be that they just need a few treatments to understand how to use a walker or a cane, or if we've put them in a wheelchair to offload, that might be one instance if we can't get any other way to do it for them. We put them in a wheelchair for 3 or 4 weeks to get the wound to heal. Then we refer them for physical therapy to get them built back up. We refer to our vascular surgeon that we have up here in the area now for those complications where they don't have good circulation.
Sure.
And can they do a procedure in order to get that blood flow back into the wound? And nutrition, we also refer, if that patient is not eating well, we have our nutritionist that calls the patient and talks with them. And then, what's one of the other ones I was trying to think of? Diabetes. That usually has to go back to their primary care physician, and the primary care has to refer them to diabetes counseling.
So you interact with primary care, particularly with chronic diseases, and I would most commonly diabetes, because the control of their blood sugar is really a critical issue to wound healing as well. as well.
And we do, with the primary care, we do a lot of coordination back to them. We let them know what's going on. Every week we fax we usually see the patients weekly.
At least.
And except for the ones that we're doing 3 times a week, but we will let the physician know what's going on with the patient, what's going on with the wounds, and coordinating with them and letting them know the blood pressures are elevated. They've,
Sure.
for the last 3 times that they've been here, letting them know those types of instances.
So your interaction with the primary care physician or the surgeon, if it's a
Or the
post-surgical
surgeon,
one,
yes.
Yep.
is really a critical part of your care, and they're getting information they wouldn't normally get as frequently and regularly as they get it from you.
At least
because
weekly
you're
they-
seeing them very regularly. Yeah. Yeah. Well, this is very, thank you very much for coming. This is really interesting, and I'm sure there are a lot of people out there that now know that you're there, and they didn't know that before. And it's a very specialized service, not available in lots of places. So we really appreciate very much your coming.
I appreciate you having us.
Yes,
It's
thank you for
fascinating
having us.
and a great service for the region. So, Nurse June Smith and Shelley Smith, we thank you very much. June is a nurse, very specialized in this area, and Shelley is a physician assistant. Not a newcomer to Boone, but a returner from Maine, fortunately, and we're
yes.
really glad to have you back.
I'm
So,
working on
thank
my
you very much for
20th
being here.
year.
We appreciate it.
Thank you.
Thank you.
Well, that's our program for this week. If you have questions or comments, you can contact us at watchapptv.com. That's watchapptv.com. And please join us again for Health Talk here on App TV. I'm Dr. Jay Noreen.